Well, as we get ready for daylight saving, it's coming. It means this time we spring forward and we lose an hour of sleep. So it's a good time to talk about sleep disorders. Dr. Kourosh Parham is here from UConn Health Center. Good morning to you.
Good morning, Terry.
So you work with patients who suffer from sleep problems. It's probably safe to say at some point in our lives, for some reason, we might encounter this.
Absolutely. We all will. It's part of life. Normal stressors will affect us all at one point or another, and therefore we will suffer some insomnia because of those issues.
And many people might say it seems so strange because sleeping should come so naturally, but it really doesn't.
Oh, absolutely.
Let's talk about some of the different sleep disorders you see.
Yeah, the most common one that I encounter as an ear, nose, and throat doctor is obstructive sleep apnea.
Sure.
This is a situation where individuals have some sort of anatomical abnormality in the upper airway that results in decreased airflow, and therefore in the middle of the night they have sleep disruptions as a result of that anatomical abnormality. Frequent awakenings, reduced oxygen, that's one of the major issues.
And that's one of the more serious forms of the disorder.
It certainly is.
Yeah.
Can be considered among one of the more significant ones because it has long-term health consequences. It can result in elevated blood pressure, poor oxygenation of the brain, and so forth.
All things you don't want, yeah.
Absolutely.
So there are long-term versions of this and also short-term, and some of those can be environmental. Tell us what are some of the things that we might be bringing into our lives or our homes or our bedrooms that are creating these problems?
Well, certainly. You can consider all sorts of factors in our environment. You know, our diet, for example, the amount of calories on a given meal, when we eat relative to sleep time. Consider, for example, if we sleep too close to bedtime.
You mean if you eat too close to bedtime?
Exactly.
Yeah.
And if you eat a very calorically rich diet shortly before bed, you become more vulnerable to having frequent indigestion episodes during the midnight, which will cause for non-restorative sleep. And that can be an issue. But there are also amount of alcohol. Is one of the factors, and alcohol has a lot of calories. Initially it does induce a little bit of sleepiness, but when that alcohol wears off, then the body will feel like it needs to awaken a little sooner. So those are some of the factors. The amount of light that we are exposed in the course of a daytime. We need a sufficient amount of light for the brain to detect that exposure for the 24-hour light-dark cycle. When that amount of light is not sufficient, we will not have adequate sleep. In other words, we have a harder time falling asleep, and when we do fall asleep, it's non-restorative.
And we need that really dark to get the melatonin working, right? Which is something that helps with sleep.
That's part of why we need their daytime exposure in order to get melatonin in nighttime.
And what about how important is it to make sure you fall asleep at the same time every day? I mean, is a sleep schedule important?
The sleep schedule is actually fairly critical.
Okay.
And that's why the disruption will matter so much to us for those of us who have a high-stress life. When we lose an hour and that schedule is disrupted, we will notice the impact the following day and for days to come. So maintaining a very strict schedule is very important when we go to bed and when we wake up. Keeping it steady is very important.
A lot of people run to the sleep aids as opposed to really figuring out what the problem is. Is it probably safer just go to your physician, call a doctor first, kind of figure out maybe between the two of you what's going on and try to attack it naturally before you go to the Ambien or these other aids that are all out there?
Yeah, definitely. You had a very nice segment a short while ago about the importance of exercise.
Right.
But there are two components to that. One is physical fatigue that will get you tired, and the other one is mental fatigue. So if you got a high demand job and you have to think about a lot of things, that will get you tired as well. So there are two elements, physical and mental fatigue. Those are the elements that you want to deal with ahead of time before you have to run to your doctor. If you got fatigue in your life, that will get you tired and you'll fall asleep. If you can't fall asleep despite the stressors and the fatigue in your life, then it's advisable to seek help from your doctor before resorting to over-the-counter pharmaceuticals.
And don't medicate yourself. Make sure you do get that expert advice from a healthcare provider.
Absolutely.
Thank you. So excellent advice. Hopefully we put some people to sleep, not now, but later. Dr. Parham, thanks so much. We appreciate it.